My name's Louise Hobson, so I'm one of the clinical team leaders. So ISPHN, which is ISPHN, stands for Integrated Specialist Public Health Nurses. The service used to be known as Health Visitors and School Nurses, but 3 years ago in 2017 we were commissioned by the council and they wanted to look at and incorporate the public health part of our role. We're all qualified nurses or midwives, so we have 6 teams, and the teams cover the whole of the East Riding of Yorkshire. We've always taken student nurses. We take first to third year student nurses, and they always have a really good experience with us. I got contacted by Jane from Hull Council, and she just asked, is there any opportunities at all for school children and college students to come and have some experience? And I said, no, I think we need to give it a go. How can young people have opportunities, to get experience? And I suppose for me, my daughter, she were wanting to do nursing, and there were just no opportunities at all for her to have some really good experience to give her an idea of what sort of jobs there were. So we got some students that came here to Halton Price, and it were really successful. They really had a good time. They worked closely with the school nurses, the health visitors, but also the nursery nurses. They saw development assessments. They were able to help in clinics. They went to do the antenatal contacts, saw the new babies at the birth visits, and they loved it. But actually for our staff, they really enjoyed it too. I think, students come to us, don't they, to get that work experience, but I think we gain a lot of things as well from taking students. You get that young opinion. For the school nurses in particular, we can say this is a campaign that we're looking at doing. It's around sexual health, or it's around chat health, which is our new texting service. So we can say, if you were struggling, or if you needed this advice, would this appeal to you? Is there anything we could do differently? What would your opinion be? A bit of a sort of feedback, service user feedback.
So I did my work placement here and also in Goole. I was with the school nurses and the nursery nurses. So I did a lot of clinics and development checks. But then in Goole, I did a lot more with the health visitors, visiting families. So I think coming to and doing this placement, it's helped me get into my children's nursing with uni, and they looked quite positively at it. Especially in children's nursing, it's quite competitive. So you want to have as much work experience as you can, and not many people can say, oh, I've worked with the health visitors, and you do that on your children's nursing course. So I've kind of had a bit extra, so now when I go onto a health visiting placement, from what you learn here, you can apply it to your interview, and when you write down on your CV for UCAS, having as much work experience can make you look so much better.